I also need to mention the mental and spiritual health benefits of marijuana. This is certainly not an indication in Maine. Pictured here is Bob Marley, Mick Jagger, and Peter Tosh. They look very happy. All of my colleagues have found that when patients come to us for one condition or another, they give the same report. Not only does this help me with this condition, but it also really helps me with my mood, or my anxiety, or my sleep. A lot of these mental conditions, my temper, my anger, my bipolar disorder. We're seeing a lot of people that have been medicating themselves with psychiatric conditions using only marijuana that are very successful. Now that might be a little risky to do so without the guidance of a practitioner, but they haven't had access to that before. To mention that marijuana can really increase a person's enjoyment of their life, their enjoyment of music and art. It seems to help inspire people to do things that they're more motivated to do, not more motivated to do, but more interested in. Those things that they've wanted to do, but for some reason they're not doing it. Marijuana, again, brings them into the present moment and allows them to make a choice that's good for themselves. It stimulates creativity. It has a lot of effects on focus and attention. And this is because it slows the transmission of neurotransmitters in parts of the brain that have to do with perception of time. And so we have a lot of reports of patients with attention deficit disorder that when they use marijuana, they are able to focus, finally. And it works in a much different mechanism than the stimulants that are usually used to treat ADD. And it's, of course, much, much safer than those stimulant medications. It gives people a sense of connection to their body, to something greater than themselves. I mean, I know we're getting in a little bit into more of the shamanic perspectives of cannabis, but that's appropriate here because this is a plant medicine. It's not grown in a laboratory. This is something that has undoubtedly more benefits to it than probably any other single medicine that's been studied. And we can connect with it at many different levels. So it helps a person globally in their whole life. It helps them with their relationship with God, with nature, with something greater than themselves. And as healers and practitioners of integrative medicine, this is really where the healing takes place. It's not changing their blood level of one thing or another. It's not helping somebody achieve some landmark or some goal. But when a patient feels connected to themselves, feels that they want to be alive and want to enjoy their life, and feels connected to something greater than themselves, whether it's their family, their community, or their higher power, that's when healing occurs. And I think that this herb really helps facilitate that. Vaporizer is a smokeless way of inhaling marijuana. There's tinctures, which are liquid extracts. You can put a certain number of drops in your mouth and get absorbed through the mouth. That works quite well. This is actually a pharmaceutical product called Sativex. I'm not promoting it, I'm just mentioning it. It's approved in Canada and some European countries for the treatment of multiple sclerosis and neurogenic pain. This is a whole plant extract produced by a pharmaceutical company and bottled into a spray that you can put under your tongue. Marijuana can also be used topically. So this doesn't have any psychoactive effects. You can use coconut oil or alcohol to make a marijuana liniment or salve or rub and put that right on the joint that's hurting, and it actually helps right there locally in many different ways. It helps the inflammation and it helps prevent the transmission of pain signals, stabilizing those nerves without any of the psychoactive side effects. So for people that are going to work that don't want to be high or for whatever reason, a lot of people enjoy the euphoria as a side effect of marijuana, but some people don't. And this is ideal for them. Also, there's certain strains of marijuana that are higher in CBD that don't have psychoactive effects. The tincture can often be dosed in a way where people are able to get the precise number of drops that will give them relief of their symptoms without causing them to get high. So there's, in a different talk, we can get more into this, but there's many different delivery systems and strains. And I think that's about it. Let's go to the next one. Oh, last question. A lot of people ask me my opinion of marijuana in driving, and I like to look at science on this. My general recommendation is to avoid it when possible. But when we look at driver simulation studies, it shows that marijuana leads to more cautious and slower driving. there is longer decision-making time needed in marijuana driving, so it might be less safe to use in cities and places with lots of stop signs and pedestrians, or people coming out from the side and things like that. It has been shown to increase variability in lane position and headway, which I think is pretty reliable. But the real important point here is that people that are under the influence of marijuana are aware of their impairment, and they compensate. They know that they're stoned, they know their perception is a little off, and because of that they drive a little slower and more cautiously. Whereas people that are under the influence of alcohol think they're fine and they step on the gas. And finally, there's no evidence of increased crashes in the population using marijuana. How am I doing on time? That's about it. Okay, so we're going to skip these next few slides, a little more of the healing path part, and we'll just wrap it up here. Thank you all for your time.